Thank you for participating in Karmanos Cancer Institute's Facebook Live segment on women's wellness. I'm your host, Patricia Ellis, Director of Media Relations, and we're broadcasting live from our main campus in Detroit. I am joined by Dr. Chidiebere Onyishi, Doctor of Nursing Practice at the Women's Wellness Clinic at Karmanos Cancer Institute in Detroit. Welcome, Dr. Onyishi.
Thank you.
We invite our viewers to type in their questions at any time throughout this segment. This discussion is for informational purposes only. It is not meant to replace the medical advice you receive from your medical provider. Please like and share us and conversation with others so they can hear too the information shared today. You can also click the follow button to get alerts regarding our future Facebook Live broadcasts. So please type in your questions in the comments section and we'll do our best to answer them. We'll also try to respond to questions following this broadcast. So tune up your volume and let's get started. Thank you, Dr. Onyishi, for joining us. First of all, you are a doctor of nursing practice and a nurse practitioner. Can you explain to us what a doctor of nursing practice is? You're not an oncologist.
No, I am not an oncologist.
Okay. What is a doctor of nursing practice?
A doctor of nursing practice is actually one of the highest degree in the nursing profession with a focus on patient clinical care.
So what can a doctor of nursing do that a registered nurse cannot do?
Sure. For myself, as a nurse practitioner, I am able to see patients. I'm able to assess, diagnose, and treat, in addition to prescribing medications. Now, a registered nurse is not able to perform those duties, and that's one of the big differences between the two.
So in the Women's Wellness Clinic at Karmanos, are you working side by side with other nurse practitioners? Who is on staff there?
Oh, absolutely. I am working with two amazing nurse practitioners. One of my colleagues specializes in the lymphedema services, while the other focuses on menopause and sexual health concerns.
And you also have access to oncologists and radiologists and other cancer specialists.
That is correct. We work in close relationship with surgeons, medical oncologists, nurse practitioners, physician assistants, the radiology department. We also work very closely with the genetics and social workers as well.
Do patients need a referral to come and see you? And also, does insurance cover it?
That's a really great question. Insurance does cover our services. Now, do you need a referral? It really depends on the patient's medical insurance. So I would recommend for anyone who would like an appointment with the Women's Wellness Clinic, just call the 1-800-KARMANOS number, and we have a wonderful concierge service. They will be able to help you get what you need for your appointments.
So if somebody has obviously a primary care physician, how do you coordinate, and do you coordinate with the primary care as far as the information that you find out after talking to the patient?
Oh, yes. Primary care providers we think, are very important. And for our patient, whenever we see our patients in the clinic, we always send a note back to the primary care provider so they know what really happened at the Women's Wellness Clinic. If there's any test results, any labs that they underwent, any kind of diagnostic studies, we definitely let them know because we want to keep them in the loop. At the end of the day, it is their patient, and we're just taking care of an aspect of their health. So we definitely want to let them know what went on with their patient.
I am here with Chidiebere Onyishi, who is a doctor of nursing practice at the Women's Wellness Clinic at Karmanos Cancer Institute in Detroit. We do have a question. A question from Jackie. I had breast cancer surgery in February of 2015. I had chemotherapy and radiation, and I'm now in remission. But I still feel tired, and sometimes there is still discomfort and tightness. Does this ever go away? And can I prevent or minimize it from coming back?
Oh, that's a really great question, Jackie. Now, that discomfort that you're having, can it ever go away? It varies for some patients. Some patients, it can last up to 5 years, 10 years, or even longer. So I think that's a question that Jackie, you really need to have a conversation with your surgeon to make sure and kind of figure out where you fall within that spectrum. Now, what can you do to minimize that breast cancer from coming back? There are so many things that you can do, including lifestyle modifications, such as no smoking, limit your alcohol to less than 1 a day, increase your physical activity, maintain a healthy diet, in addition to maintaining a healthy weight. That's something very crucial that we actually have control over, and we can do that. In addition to that, I would recommend that that you or anyone out there Make sure you're getting your mammograms. It's very, very important. And follow up with your medical providers. That's really key.
So Karmanos Cancer Institute is a cancer center, obviously.
Yes.
But do you have to have cancer to come and see you at the Women's Wellness Clinic?
Wonderful. That's a wonderful question. And the answer is no. We welcome all patients, any breast concerns, men, women, anyone with any issue, including lymphedema, which is swelling in the arms, anyone with concerns such as sexual health or menopause issues. We welcome all those things to our clinic.
So men can come and see you at the
Oh,
Women's
yes,
Wellness Clinic.
absolutely. And we do have a great male population within our clinic. Absolutely.
So
Absolutely.
do men get breast cancer also?
Yes. Yes. And many people do not know that, but men can get breast cancer. And that's really important. We need to educate everyone on this issue because it is very important. Men can get it, women can get it. Younger women can get it, older women can get it. So it's really important that we're educating ourselves on this disease and figure out what we can do best for our health.
I'm here with Chidiebere Onyishi, Doctor of Nursing Practice at the Karmanos Cancer Institute Women's Wellness Center. And we have a question from Mark. All right, Mark.
Great.
one of his nipples is darker than the other. Is this okay? Should he be concerned?
I always say whenever there is a breast concern, you need to get it evaluated. One of your nipples is darker than the other. If you were to come to the Women's Wellness Clinic, we need to take the history behind that. Now, is this how you were born? Did this happen all of a sudden? So these are things we take into consideration. That's why we providing individualized care is very important. So for Mark, I think that having a conversation with a medical provider, and if you come to the Women's Wellness Clinic, we would definitely take care of that.
So what are some of the other concerns and changes in the body that people should be aware of, whether a man or a woman?
Sure. Now, changes in the body can include so many things. For the breast, for instance, we think of nipple retraction. We think of breast getting swollen. We think of puckering in the breast, dimpling in the breast. We think of asymmetry in the breast. One breast is getting bigger than the other, for instance. Those are things, including discharges. Those are things that we take very seriously and want to make sure that there's nothing else malignant or bad or underlying going on within the breast. So we definitely take that very seriously and get it evaluated.
So even if a woman is experiencing some of these changes during their menstrual cycle, is that normal?
It can be. It's possible to be normal, but that's why a conversation is necessary. So I think seeing your medical provider, they get a history on you, they figure out what is best. Do they need further evaluation of whatever the case might be? So I think if you have any concerns, definitely see your provider on that. And Women's Wellness Clinic is great for managing those kind of concerns.
How many people do you see, men and women, on an average at the Women's Wellness Clinic?
On the average, we see about 250 to 300 a month.
Oh,
a month,
wow.
yes. And we still welcome new patients to come on down, and we'll definitely do our best to give you the best possible care.
We have another question from one of our viewers, Tammy. I hate pain. How painful is it to get a mammogram?
How painful is it? That's a relative question. Some women will tell you, well, it's not really as painful as I thought it would be. Some people tell you, oh my God, it's the worst experience ever. But the one great thing I always tell my patients, at the Women's Wellness Clinic, we do our very best to make sure our patients are very comfortable, because that's important. Once a person is comfortable, then they're willing to undergo whatever diagnostic workup that you recommend for them. So if you hate pain and you feel like it's going to be very painful, come to the Women's Wellness Clinic. We will do our very best to get you as comfortable as possible so that you can get your mammograms.
I want to talk to you a little bit more about mammograms in just a little bit, but I want to find out, you talked about, the number of people you serve in a month, men and women. What is the age range of the people that you see?
Our patients are really, we like to see patients a minimum of 16 years of age at the Women's Wellness Clinic.
So even young people at 16 years old can have these changes?
Oh, absolutely, absolutely. A young woman can get breast concerns, and that's why we welcome them, even if it's for just educational session. So educate them on what's going on, educate your family members on so they're comfortable. We do provide that for our patients.
Okay, very good. We do have another question, and this is from Alice. What is the best diet for following breast health?
That's a really great question. The best diet is a healthy diet. And I say that specifically a cardiac healthy diet. You want to, of course, limit the grease and the fat and just make sure that whatever you're eating is healthy for you. Get enough vegetables and fruits and things of that nature within the diet.
I want to talk a little bit more about the mammograms now. First of all, what is your recommendation on when women and men, if there's an issue, should start getting tested, or start having their mammogram? What is it? What is your practice here?
Well, there is really no one answer to that question, but here at the Karmanos Cancer Institute, we like to follow the NCCN guideline, which is the National Comprehensive of Cancer Network. They recommend that a woman with an average risk start their screening mammogram at age 40 and every year after that, and that's the guideline we follow. However, it is important to recognize that there are other guidelines out there that other institutions can follow, and it's not wrong. So just make sure that your medical provider is following a certified guideline. But here at Karmanos Cancer Institute, we do follow the NCCN guidelines.
So you mentioned women at normal risk. Mm-hmm. What is a non-normal risk, higher risk?
Yes, yes. Women at a high risk are individuals, for instance, with a history of breast cancer, patients with positive genetic mutations such as the BRCA1 and 2, patients with extensive family history of cancer, or even patients with genetic mutation within the family members. Those are considered high risk. In addition to that, there are patients with biopsy-proven high-risk lesions that we also take into consideration.
So many people won't even know if they have a genetic disposition. Mm-hmm. Do you have genetic counselors on staff here that would be able to step in and help with that, should that be needed?
Absolutely, and we work very closely with them. We do share mutual patients. Now, when I see my patient and I feel like they do require some genetic counseling to kind of help them figure out things, I will refer them to the genetics department, and that's something that I consider when I see my patients for high risk.
So, can men and women carry the BRCA gene or another genetic mutation that could lead to breast cancer?
Yes, absolutely.
So it's not just women?
It's not just women.
We have another question. This is from Linda. Why should I come to your clinic to get a mammogram as opposed to a general hospital?
That's a really great question, Linda. Now, remember, Karmanos is a NCI designated comprehensive cancer center.
What does that mean?
Now, that means that we do provide a comprehensive care when it comes to cancer. We are the experts. This is what we do all day. Every day. So if you're going to get a mammogram, wouldn't you want to go to the experts? I know I would for mine. So I think it is important to keep that in mind when you're thinking of getting your mammogram. And that's one of the reasons why I definitely recommend for all individuals to definitely take a look at the Women's Wellness Clinic and see the services that they provide. The radiology department are excellent. They're wonderful in reading mammograms, and they are, in my opinion, one of the best.
So I need to know from you, your expertise, does cancer occur more in women of a certain age? And I've often heard that women of color may experience a more advanced stage cancer. Can you explain that and why?
Sure. Breast cancer is a disease of aging. So we typically see breast cancer in women above the age of 60. Not to say that we cannot see breast cancer in younger women, because it can occur. But we definitely see it a lot more in women above the age of 60. Within that population, that's when we typically see it.
And what about women of color?
Now, women of color, that's a really great question. Particularly in the African American community, we tend to see breast cancer that is more advanced, and they tend to have a lower outcomes in terms of the treatment. So, but this is not the case for instance, say the Hispanic women. So African American women definitely need to pay more attention because they can get a more aggressive kind of cancer, and that's what we see. And there are studies out there they're going on right now to figure out why is this the case, but we're still waiting on the results for that.
So what would your advice be for anybody listening to this, whatever the color they might be, as far as acting on any changes they see in their body?
Any change in your body, see a medical provider for it. If you don't have a medical provider, feel free to come to the Women's Wellness Clinic, whatever the change might be. It can be anything, the nipple discharge, the rash, the nipple inversion, or anything, any swelling, any redness, and you're concerned about it, we are happy to take a look at it and just to make sure.
Okay. We have another question. This is from Sarah. I've never had a clinical breast exam done. Is it painful?
A clinical breast exam, I don't really think it's painful, but keep in mind what the purpose is. A clinical breast exam is just trying to make sure if there's any abnormalities within the breast that we can palpate or we can feel with our hands. So we definitely make sure that our patients are comfortable and we try to provide the best services for them.
What does it mean when somebody has dense breasts, and what does that look like, and is that cause a higher risk for breast cancer?
Sure. Dense breast just means that you have more fibroglandular tissue within the breast.
What does that mean?
That means that you have a lot more tissue, a lot more fibroglandular tissue. So therefore, when they do a mammogram, you see a lot of white. Because remember, mammogram is an x-ray of the breast. Mm-hmm. So when a woman have dense breasts and they do a mammogram, you see a lot of white areas in the mammogram screen. And this is very important because those white areas can obscure things or hide things on the mammogram. And that's why when we see that, we like to have a conversation with our patients and let them know that there are other things that we can do for them to be able to see through those layers and make sure that they're getting the best possible care.
In 2015, the state of Michigan adopted the breast density law. I am not sure I'm saying the title correctly, but tell us what that is and why that's so important.
Well, that is important. It is now a Michigan law that if a woman have dense breasts, that the institution where they had the mammogram send a letter back to the patient informing them of the breast density. And that's what we do here at Karmanos as well. But at the Women's Wellness Clinic, we take it a step further. And we actually sit down with our patient and actually talk about it so that they're not afraid when they get a letter like, what is dense breast, you know? So we sit down, we educate them because it's normal to have dense breast. It doesn't increase your risk for breast cancer. Why is it so all of a sudden everyone is talking about it? Is because it can obscure things on mammogram. So there might be something hiding underneath and we're not able to see it. And that's why there are other modalities here at the Women's Wellness Clinic. Sometimes we can recommend things such as a 3D mammogram, a whole breast ultrasound, sometimes even a breast MRI for these patients.
So somebody can still get that letter, have a normal mammogram, and have dense breasts, and it's really just to acknowledge that you may want to have a further discussion with their doctor.
Yes, and to let you know that there are other things out there that can be done for you.
Okay, wonderful. I am here with Chidiebere Onyishi, who is the Doctor of Nursing Practice at our Women's Wellness Clinic here at Karmanos. We have another question. This one is from Tina. Is there anything for me to tell, any way for me to tell, if I have dense breasts without making an appointment?
Now, the best way for you to know if you have dense breasts is through a mammogram. So you need to get a mammogram, and that will be able to tell you your breast density.
And they'll get that letter if they have breasts, right?
Absolutely,
okay.
Absolutely.
Right.
And if you're concerned about that, make an appointment and come to the Women's Wellness Clinic, and we'll sit down with you and go over all that details.
You touched on this earlier, those at higher risk. Who might that be?
Great question. High-risk individuals are those with, for instance, a history of breast cancer, patients with positive genetic mutations, patients with extensive family history of cancer, patients with biopsy-proven high-risk lesions, or patients who have had radiation to the chest. They're considered high risk.
Isn't it true, though, that majority of women who are diagnosed with breast cancer don't have any history at all?
Absolutely.
Right?
That is true. That is true.
What is that percentage, do you know?
I believe it's about 13% or so of women who are diagnosed actually have a family history, and the rest don't. So most breast cancer is sporadic. It just happens on its own. So I always tell patients, just because you don't have any kind of genetic disposition within the family or even a family member with cancer does not mean you cannot get breast cancer. That's why it's important to keep making sure that you're doing everything possible you can do for your health. That's where that lifestyle modification, we keep stressing on that. No smoking, limit that alcohol to less than 1 a day, increase that physical activity, maintain a healthy diet, maintain a healthy weight, get your mammograms. Mammograms are very important. And make sure you're following up with your medical providers.
Okay.
That's very important.
Can you explain a little bit more about lymphedema? What is it? What happens to the body when you have lymphedema?
Sure. Lymphedema is really swelling in the arms or legs that typically occurs as a result of removal of the lymph nodes.
And that would be removal of the lymph nodes at a time of surgery?
Yes, that's correct, because it typically is part of the treatment protocol for cancer. So that can occur. The swelling will result as a result of removal of the lymph nodes. The swelling will occur.
Can benign breast cysts eventually lead to breast cancer?
Great question. No. Benign breast cyst does not lead to breast cancer, and you can have multiple cysts and still don't have breast cancer. No.
Okay, that's good to know.
Yes.
I want to talk a little bit about some of the myths.
Okay.
Because we've heard, those of us that underwear your bras or wearing a bra for a long time, can that lead to cancer?
That's a really great question, and I get that all the time in my clinic. I tell my patients, you can wear any kind of bra you want to wear, underwire, no wire, sports bra, lace bra, whatever you're comfortable. Just be comfortable. Bras does not lead to breast cancer, no.
What about deodorants?
Deodorant does not lead to breast cancer. The studies that we're seeing, it has nothing to do with breast cancer. Deodorant, antiperspirant, all that has nothing to do with breast cancer.
I have heard, being a coffee fan myself and a chocolate fan, that caffeine can sometimes cause more pain when you get your mammogram. Is that true?
No, that is true. That is definitely true. Caffeine can increase breast pain. And the reason why is because when we ingest a lot of caffeine, it can increase those microscopic cysts in the breast, and that's what's causing you the breast pain. So I always tell my patients, when you come to us and for breast pain and we rule out malignancy and make sure there's nothing going on, it's important to pay attention to what you're ingesting. And you will find out many patients will ingest a lot of coffee, the tea, the chocolates, all that caffeinated beverages that we like, and the breast pain keeps coming.
Yeah,
so
I can relate to that. I guess I need to stick to
we need to minimize
caffeinated.
Yes. Decaf all the way. I always tell them we need to minimize that. Definitely.
We have another question from one of our viewers. This is from Jamie. Is it true that breastfeeding can increase your chances of getting breast cancer?
Now, that is false. Breastfeeding can actually reduce your risk of getting breast cancer. So we encourage all women, if you have a baby and you can breastfeed, to go ahead and do that. It is better for you, and it's also better for the baby.
So if somebody does have breast cancer, whether they were treated here at Karmanos or someplace else, why should they make an appointment to see you at the Women's Wellness Clinic?
Like I said earlier, remember, Karmanos is an NCI-designated comprehensive cancer center. Cancer is what we deal with every day. So it is important to go to the experts to take care of your health. Now, at the Women's Wellness Clinic, we have a focus on breast. So if you have any breast concerns, or if you just want a second opinion, we welcome that. Come, we'll sit down, we'll have a conversation on your health. Our care are all individualized to the patient, and that's very important. And we always collaborate with other medical providers just to make sure that our patients get comprehensive care.
So if somebody in the family, maybe you don't have breast cancer, but you know somebody, one of your loved ones does, they can still come to you and be counseled by you.
Absolutely.
And even get their mammograms here if
Absolutely.
they choose to do so.
That is correct.
Okay.
That is correct.
Why is that continuum of care so important?
It's very important, especially for our breast cancer survivors. And we try to maintain that relationship. And for us, relationship is key, because when you build that relationship with a patient, they're more comfortable to want to disclose any health information or even talk about things that ordinarily they wouldn't want to talk about. Right. So for us, relationship is everything. And for our patients, we like to really sit down and make sure that they're getting the best care. They're getting their mammograms. They're working on that lifestyle changes to better themselves. And we're here in the event there's any recurrence. For us, catching it early is key. So following that patient and making sure that they're doing everything that they can do, making sure they're getting their mammograms. If we see anything, we're catching it early and we're getting the treatment going.
Wonderful. We do have another question, and this is from Val. I am nursing. Is it okay for me to get a mammogram?
Great question, Val. It is okay for you to get a mammogram even though you're nursing. However, we will encourage you to try to nurse right before getting a mammogram. It will be much more comfortable for you.
So I want to just synopsize real quick. I would like you to say what are the top 3 reasons why someone should see you at the Women's Wellness Clinic?
At the Women's Wellness Clinic, we follow any breast concerns. There is no problem too small or too big. Just come on in and we'll take care of that. If you're having any concerns about lymphedema care, we will handle that for you. We'll be able to take care of that. If you have any problems with sexual or menopause concerns, we will be able to take care of that.
So that is whether you have cancer, or whether you've never been diagnosed, whether you may have it in the family, or whether you just want to come in and get your mammogram and be with the cancer experts who are best to determine if there is any issue to be concerned about.
Absolutely. Or whether you're a man or a woman, doesn't matter. We welcome everyone.
So if somebody has questions, where should they call?
Oh, absolutely. They should call the 1-800-Karmanos number, and we have a wonderful concierge service. They're able to decipher through the questions and figure out what a patient needs, whether it's for an appointment or to leave a message for a provider. They're able to take care of that.
We do have another question here, and this is from Precious. Does your clinic offer mammograms to the underinsured patients?
That's a
or
really,
uninsured?
Yes, that's a really great question. And yes, everyone is welcomed. We will work with you to make sure that you get what you need. Even if you don't have medical insurance, we have services out there that can assist you to provide, whether it's a mammogram or see a clinician within the Women's Wellness Clinic. But the key is, regardless of what your situation is, as long as you know you want the service, call the 1-800-Karmanos and we'll take it from there.
So even if somebody doesn't have cancer,
yes,
they can come and receive your services and be at ease and know that they are with a team of experts that can answer any questions that they have and follow them.
Absolutely. That is correct.
Wonderful.
That is correct.
We do have one more question, and this again is from Vivian. Do you have any support groups?
Oh, yes. Support groups are wonderful, and we definitely encourage our patients and family members to try our support group. Now, for our support group, we do have wonderful social workers that will coordinate with the patients or family members to make sure that they get them to the appropriate support group that they need. Absolutely.
So what I'm hearing is that you have a very comprehensive approach to breast health.
Yes, yes. Women's Wellness Clinic is all about individualized, comprehensive breast care. Absolutely.
This is very timely with the National Breast Cancer Awareness Month coming up. So thank you, Dr. Onyishi.
Thank you. Thank you.
And we really appreciate everything that you do in your clinic. So this is Patricia Ellis. I am the host of the Facebook Live. And I want to do a special thing. We do another question. Okay.
Oh, okay.
We do have one more question, I believe. So we talked a little bit earlier. If you don't have breast cancer, you can come to the clinic.
Yes.
But what if you have another type of cancer? Are you also able to seek the services of the Women's Wellness Clinic?
At the Women's Wellness Clinics, we're able to refer our patients. If there's other cancer that they're dealing with, we're able to refer them to the appropriate services. So, but they can still come to the Women's Wellness Clinic if they're not able to get the service that they need, and we'll be able to make that appropriate referral to figure out what exactly the patient needs.
Again, another advantage to having a team of cancer experts right here.
Absolutely.
Okay, that's fabulous. We are going to start wrapping up now, and I want to thank Dr. Onyishi again for helping to be part of this segment. If you have any additional questions, please send them through. We will try to answer them as best as we can, even once we go off the air. I would like to give a special thanks to the Facebook Live team, Tamara Collins, Sean Cook, Tim Harnert, Megan Semerez, and Linda Remington for their support. I'm Patricia Ellis. Thanks so much for tuning in.
Thank you.
Thanks again for everything.